Dr. Forman, tell me a little bit about what a patient can expect when they come into the emergency room here at Kent Hospital.
So in the emergency department, we've revised all of our protocols to ensure that we're being compliant with social distancing regulations and doing everything that we can to protect both staff and patients from the coronavirus. So when patients initially come in, they're met outdoors by a screener, a nurse who goes through a series of questions with them to ensure that we best understand how high risk they are for the coronavirus at that point in time. They're asked a series of questions about potential exposures and the symptoms that they have. We make sure that patients are socially distanced as they come in through the emergency department, and we've restricted our visitors to make sure that we're not unnecessarily exposing anybody here. They come in through the front doors. After the initial screening, they go through a triage process here with a nurse and a tech to place them in the emergency department in the most appropriate place. We have divided the emergency department down into higher risk areas for COVID. We have an isolation unit with negative pressure rooms, and then we have lower risk patient areas as well, still maintaining appropriate social distancing throughout.
So do you want to show us the triage unit?
Mm-hmm.
So we're now in the triage unit. What happens here?
So when patients initially come through, they are screened by a nurse and a tech who get a set of vital signs and a chief complaint and better understand why they're here in the emergency department and what they might need. From here, they're then placed into a room and they come into the main emergency department.
Okay, let's take a look. So here we are in the emergency department. And we're here, we're open, we're safe.
Yes.
So what happens in the emergency department now to keep everyone safe?
So we have gone through every protocol that we have in the emergency department to ensure that it is compliant with all safety standards and that we're doing everything we can to protect both staff and patients from the coronavirus. It's important to understand that we in medicine have been working with people who have communicable diseases, highly communicable diseases, for as long as medicine has been in effect. So the protocols themselves aren't new, but what is new is the frequency with which we're seeing patients who have this infection and the severity of it in the community. So once patients come into the emergency department, they get placed in rooms and seen here. The staff is wearing masks the entire time, and the staff is in full protective gear anytime we have patients who might potentially have the coronavirus. They're cared for in separate patient areas, and we've increased our cleaning protocols. We do what's called a terminal clean, a very thorough cleaning of every single room after patients leave. And we have increased the number of environmental services staff here in the emergency department and throughout the hospital to ensure that the rooms are clean.
In brief, Dr. Forman, this is something that you're used to doing every day.
Every single day. So we are doing this day in and day out. We're seeing about 160 patients a day now. And so we've learned to become pretty adept with these processes.
And you've handled patients with serious care like this before?
Absolutely. So the protocols that we use are very similar to protocols that we were using to take care of patients with tuberculosis, for example, and other airborne diseases. So we are very accustomed to these processes. We're just taking care of more of these patients now and screening and isolating a lot more patients than we were in the past.
And what do you want patients to know who may be hesitant about coming to the emergency room?
So the emergency department is open and safe and ready to care for all patients regardless of why they're here. We're taking care of patients with COVID, but we're isolating them and keeping them separate from patients who don't have COVID. We're being extremely careful. We, on the front lines, want to make sure that we're not infecting anybody with this disease, so we're being incredibly careful about isolating and caring for people. So we want people to feel safe coming in. We want them to know that they are safe coming here, that this is a clean environment and a safe environment for all patients.